whole purpose really is to keep us alive, right? It's all about survival. Unfortunately, when we go through something quite debilitating like a traumatic brain injury or some type of a virus or disease or an encephalitis or COVID, um, our body realizes that it's under attack and its life is threatened. And if these symptoms and if we go untreated for long enough, the body can start to just be in this fight or flight or survival mode almost all the time. And it's because it realizes that it's still not healed and that it's still injured, um, and that it still needs help. And so we have some patients that have gotten injured and quite acutely, so meaning maybe in the first couple months or so, they're dealing a lot with their headaches, they're dealing a lot with the vision issues, the cognitive issues. But if they go untreated or they don't get the proper treatment for maybe months to maybe years, we see patients that are now struggling with what we call this dysautonomia, which is they might have an increase in blood pressure now. They might have difficulty with breathing. They might be more panicky. They might have difficulty with hormonal regulation, with just basically being able to breathe and to function on a daily basis. The reason why is because your autonomic nervous system is divided into two branches. There's the sympathetic branch, which is that fight or flight, right? Which is the, okay, something's happening, we're running from a bear, let's just, let's keep ourselves alive. So body temperature goes up, breathing goes up, our body is geared to fight. Then there's the parasympathetic side, which is the rest, the digest, calm down, we're okay. And what happens with dysautonomia is the body's inability for the parasympathetic to come on and to trigger and to calm that sympathetic side down. And so we often have patients that will say that they almost always feel like they're under stress, or they might exercise and they notice that as soon as they exercise and their heart rate goes up, their body just shuts them down. And what I typically say is that what's happening is that your body cannot understand or it doesn't realize that your increase in heart rate is due to exercise. It's misinterpreting these triggers and cues as life-threatening. And we're running from the bear now. Is that what's happening? Okay, let's run. And so your body's in this constant state of survival. And I can't tell you how many patients look at me at that point when I describe this and they just are tearing up saying that that's me and I was never like this before. Well, these headaches, this dysautonomia can actually cause a lot of the headaches that you're experiencing as well, especially if you're noticing that you have headaches after exercise, or if you have headaches after being stressed, okay? And again, this is just your body's way of saying, I need you to survive and you need to fix me. So in a way, your body's doing what it needs to do, but it reaches a point where it's not, it's just trying to signal you to fix it, but it's making you sicker as well. So I want to make sure that I don't end this with all doom and gloom because it can sound a lot like, oh my gosh, headaches are inevitable and they're never going to go away. And that's actually not true. We treat a lot of patients here at Cognitive Effects with these chronic headaches. Our typical patient does not come to us 1 month after an injury. Our typical patient finds us 3 months to 3 years post an injury. So you can imagine we have quite a bit of experience with this dysautonomia and with this survival and with this fight or flight, but also with these patients that have headaches that have not gone away for months to years, sometimes decades. And we've been able to successfully help a lot of these patients once they find out and realize that the root of some of these headaches and the root of their problems were from the traumatic brain injury themselves. I'm really hoping that this bit of education will help you maybe look back into your past and think, okay, when did my headaches actually start? Did they really just start out of the blue, or could I possibly tie them to an event that occurred. Sometimes we get injured when we're too young, and so we have to maybe ask family members or parents, siblings, hey, did something happen to me when I was younger? Did you notice a change? Because sometimes we don't really remember. But most of our patients, once we start probing and asking these questions, most of them did not have headaches that just literally started out of nowhere. There's usually some type of precipitating event that they've never actually drawn a line to. And so what do we do here to help with these concussions? Well, we understand neurovascular coupling. We understand how after a brain injury, your neurons are not metabolizing. They do not metabolize at the same level, at the same rate. We understand how a neuroinflammatory event can really change, for the worse, really, how your brain is wired. Many of you have probably heard of the term neuroplasticity, and neuroplasticity is a wonderful term, but what people don't realize is that neuroplasticity can go both ways, okay? So what allowed your brain to change so dramatically for the worse after a concussion is also neuroplasticity. But what can allow your brain to improve and to get better and to become more efficient is also neuroplasticity. Neuroplasticity, very simply, is your brain's ability to change to its environment. And here at CFX, what we're trying to do is open up windows of neuroplasticity and utilize different multimodal therapeutic techniques to get your brain to rewire. And we know where those regions are and what we need to do because we do something called an fMRI scan. This fMRI, or we call it functional neurocognitive imaging, or FNCI, allows us to actually see how different structures are metabolizing, which areas are working well, which areas are working efficiently, but more importantly, which areas of your brain might be overworking and overcompensating for some areas that are not working hard enough. And that is our roadmap to help us determine where the source of some of your headaches and other symptoms might be from. And if we can then adjust that neurovascular balance, if we can also adjust the dysautonomia, because we treat the dysautonomia, if we can also adjust the vision, because we have vision specialists here that can address that, we have vestibular specialists, we have speech and language therapists, cognitive therapists, neuromuscular therapists, physical therapists, clinical psychologists, neurointegration specialists, and so on and so forth. We utilize all these therapies together in a very intense program that allows us to help your brain change for the better and to identify what some of the sources of some of these headaches and other symptoms are. So that's what CFX does in a nutshell. Just to end, before I take some questions, one of the other questions I get asked is, what are some of the things that we can do at home? And some of the best things that you can do is to, number one, follow a consistent sleep pattern. There is something called sleep hygiene that is really important, especially for patients with traumatic brain injury. Go to bed at about the same time, wake up at about the same time. There are a lot of really good resources about what sleep hygiene is and kind of cleaning your environment for really good sleep. So consistent sleep is huge. Another really good thing you can do on your own is just making sure you're getting really good exercise, some regular exercise daily. The timing of that exercise is important as well. Some people love to exercise and that calms them down for sleep. Some people that amps them up. So make sure you time your exercise correctly. What you're eating. So your diet is a big piece as well. So make sure that you're eating well, that you're not eating foods that are going to maybe give you a lot of energy late at night to interrupt that sleep. There are also some foods that are tied to inflammation that you might notice can lead to headaches. Find out if you have allergies. There might be a gluten allergy. There might be a soy allergy. There might be a milk allergy that might be contributing to some of your headaches as well. Again, try massage therapy. If you have some cervicogenic issues, some physical therapy, some massage might be really helpful. We also have a headaches course. CFX offers a great headaches course online that you can find on our website. But one of these other things that could be really helpful is this Zoop device as well. This is something that we give to some of our patients who are here with these intractable headaches, and that can absolutely help them as well. So I feel like I've talked a lot. I want to make sure that I don't bore you all to death, and make sure that I get some questions answered at this time. But thank you so much.
All right, let's see what questions you have. Is there any chance my migraine symptoms might go away in a few years?
Oh, that's it's a really good question. A lot of that depends on how long you've had these migraines, what the cause of the migraines were. If these migraines happened after some type of an event like COVID or concussion or some type of a triggering event, the odds of it going away on its own are very slim. Very slim. You're probably going to need some sort of intervention.
Any questions?
Yeah. We have a couple comments from Love Penny Bronzel. It says, a couple here. Still in bed right now watching this because I'm female and post-concussion and have a history of migraines. The concussion made the migraines and chronic headaches worse 100 times.
Yes.
She also goes on to say in here, 3 herniated ruptured discs in the C-spine, migraines after concussion, major problem walking, thinking, and doing anything. And that she wants to come, but she's just waiting on finances.
Awesome. Well, thank you so much for that. I feel for you, and I applaud your bravery for putting that out there like that, because I think I love doing these types of educational lectures and live videos because it brings people together, and I hope you feel like you're not alone. There are so many people that are watching this and will be watching this that experience what you're experiencing. I think one of the most debilitating symptoms or effects of these injuries is feeling so alone and isolated that nobody understands. And I'm here to tell you, you are not alone. I'm hoping that this really helps you see that there is hope out there, and that patients come to us from all over the world with similar symptoms, not being able to get out of bed, but just don't give up on yourself. Don't lose that hope. And we have different options too. You can always just start with the scan. You can start with the headaches course. Please just contact us, and we can help direct you from there.
All right, we have one more question here. I had brain surgery. I had brain surgery. Can it help if I have nerve damage? Maybe that's relating to the device.
So what I want to say to that is my partner, for those of you who didn't hear from the beginning, one of my partners here is a neurosurgeon, and he will tell me that any sort of neurosurgery, even if it is to save a life, is still brain trauma, right? And so it is not saying that it's not necessary and it's not very helpful, but you may have some issues after your brain surgery. And yes, nerve issues are very, very common. And I think that there are lots of different types of techniques that you could try to help that. And Zook is definitely one of them. If anyone has a question, please feel free to contact us here at CFX, and we can help direct you to the right treatment, or to another provider, or to help you get help with us.
So we have another question here. Can dysautonomia correct itself with time? What are the treatments for nervous system imbalance?
Yes, so that is a really hard question. With the almost 7,000 patients that we've seen, I think what we've shown is that for most of the patients that come to us, the dysautonomia does not correct itself over time. It needs the right type of intervention. For example, like I said, we have patients that have had significant exercise intolerance, let's say. So these are people that were really athletic before their injury, and then now they can't get their heart rate up above a certain level and before their brain and their body shut down. These are people that have been struggling for years and years and years with these patients. Because, and what's so hard with patients like you is that you look so normal. For most of you, you're the walking wounded. It's an invisible injury because, you're not missing an eye, you're not missing an arm, you look so normal. And that is so, so frustrating and invalidating to some patients who are like, I'm not normal. I know I look normal, but you don't know what's going on inside here. That's where our advanced neuroimaging really comes into play, and it's a strength because we can show that even though you're functioning normally and you can pour yourself a bowl of cereal when you're hungry, when you do these different types of tests in our MRI machine, we can actually show how your brain is wired and how inefficiently it's wired and what it's costing you internally to function at the level that you're functioning, whereas no other type of imaging or test can show that. And so this dysautonomia is one of those issues where, you do look so normal, and the dysautonomia only triggers certain times. It doesn't always trigger all the time. And so, it can almost seem like, what really is this that you're dealing with? Is this really a real thing? This dysautonomia tends to not go away on its own. We have different techniques here that tend to help trigger that parasympathetic response to get that to balance more. And so, that's the answer to that, is that most of the time, as far as we're aware, and with our patient population, it will not go away on its own. It needs specific intervention. Did I answer that question completely? Okay.
That's great.
We have one here that says from Isabel Glassglow. How can I pinpoint what triggers my headaches?
Well, that's a really good question. I think what you need to do is find out where the headaches are starting. So on our website, and actually we can maybe put a link to that in this, but we actually have a great blog article that we wrote about the different types of headaches. So what you can do is maybe pinpoint where it starts. Does it start in one point and then spread? Does it start in the back? Does it start behind the eyes? Does it start in the jaw and move up like a lot of autonomic nervous system headaches can do? So maybe trying to pinpoint where it starts would be a good start, because if we can pinpoint where it starts, then we might be able to identify what those triggers might be for you. So for example, if it's one that starts in the occipital, kind of in the back of the neck and goes up, I might say, okay, that might be a tension headache, or that might be a cervicogenic headache, or it might be both, right? It doesn't just have to be one or the other. And then we can start to look at treatments or triggers for those headaches. On the other hand, if it's starting behind the eyes, right, then we can say, okay, I think a trigger for you is visual stimulation. And vice versa, if you have a headache that kind of starts in the jaw and then makes its way up, that might be more autonomic nervous system, and we might have to look at the dysautonomia. So I think maybe not trying to go back and finding out what the triggers were, but finding out and pinpointing where your headache starts and then travels is a good way to work backwards.
We have a couple of people asking about the device that you mentioned, the Zoop device. If, like, what it does, how it helps people, what kind of symptoms does it help with?
So the better person to answer that would be one of my past patients, actually, and his name is Spencer, but I can answer that as best I can. So the Zoop device, we've used it with quite a few patients here, and I know that there are a lot of patients that see a benefit from this for these intractable headaches. But what we find with our patients is that it can help almost, in a sense, distract some of the pain cycle. When you are in a chronic pain cycle, your body really kind of just attends to that. And it's almost, I don't want to misspeak, but it's almost like a cycle that just kind of feeds off of itself. And this device can interrupt that communication with the nerves. It can interrupt that chronic pain pattern and help the brain reset. And so what I know that Spencer states or says, always try it. If you're having these issues, just give it a try. I think it works for about 70% of these chronic headaches. There's no harm in trying it, right? Seeing if that works for you. And as Spencer would say, the reason why we're doing this today is because this helps distract the brain. It can help bring down the symptoms significantly. But what we do is try to help get to the root cause of the problem, and try to identify if we can get rid of the headaches completely, and not just the headaches. Because if you are having headaches, that is usually a correlate symptom of other brain issues that are going on. That is your body's kind of easiest way to say, hey, I'm not okay, something's still wrong. And so very rarely do we have someone that says, yeah, my only issue is headaches. That's just one piece of the puzzle.
There's one more question about hypnosis.
That's a good question. I don't get that question too often, but my answer would be the same, which is, often with hypnosis, it is your brain, distracted, and trying to kind of reroute potentially some of that pain response. Some people don't respond to hypnosis. Some people do. So I would just say, look, it's not going to hurt you. So it's worth trying, but it doesn't work for a majority of the population, especially with these chronic issues. And again, the hypnosis is not going to help the neurovascular and the dysautonomia and the vision, vestibular issues. It might just help temporarily with some of the pain.
We had a question from earlier, somebody asking if they had brain surgery, but they had nerve damage, and they're wondering if treatment here helps that.
So my answer to that would be our neurosurgery partner sends a lot of his post-surgical patients to us because we can definitely help with with many aspects of the trauma that's associated with just the neurosurgery in and of itself. I would strongly recommend doing a consult with us. The wonderful thing is that our consultations are free of charge. It is a risk-free consultation that can be scheduled. We'll put a link in the video, or we'll put a link somewhere.
Yeah, we'll put a link in there for everyone to be able to access that.
Yeah, awesome. And one last thing is, for those of you who use this link in particular, if you've watched this video and you use that link in particular, we are offering a 10% discount, which we don't really do very often. I don't think, hardly ever, right, Chance? So for those of you who are really interested, the consultations are free. And if you then decide to even just start with a scan to see what's going on, or if you want a week of treatment or 2 weeks of treatment, you will be able to receive 10% off whatever you choose, whatever you decide to do with us. And that will be for limited time.
Awesome. Thank you, Dr. Fong. Thank you, everyone who has joined. And this will wrap up here. And you will be able to get access to that link posted on all social media channels here. And we appreciate everyone attending.
Thank you.